When I would come to lunch, which I do most days in the medical center, I would pass this long line waiting at the pharmacy. And each time I passed, I felt badly for the patients who were having to wait such a long time and for the staff who had the pressure of all of these folks sitting and waiting. Now when I walk over to the cafeteria, the lines are short, people are happier, it's not nearly as chaotic. That's the kind of success that obviously breeds the desire to spread it throughout the whole system.
In 2010, we realized that the Affordable Care Act was coming our way, and we realized that there were many, many things that we needed to do to get ready for that. One of the major things that the Affordable Care Act did was to cover many more people with insurance, but at the same time, it required that we needed to be a provider of choice, that we couldn't just be the safety net place where everybody came because they had no choice. So that was the beginning of the thinking about why we needed a consistent philosophy and set of tools for improvement.
We were extraordinarily fortunate here in the health system to have champions for LEAP in the medical center. Seeing the results that they were able to accomplish within the medical center made it not just an easy sell. Actually, other divisions wanted to have LEAP spread to them because every division has problems that they want to solve. So it's absolutely applicable and has already produced great results in our behavioral health division, in our aging and adult division, and literally as we speak right now, we're working on it in our public health and policy division.
I would describe LEAP as a way to continuously improve a system of work. So it's basically a way for the staff that's engaged to really look at the services and processes that we provide to our patients and make them more efficient, smarter, faster, more effective, and really a way to give our patients more value.
What LEAP is a system by which we identify those problems and then ask the line staff, often with input of our patients or our clients or our customers, to come up with solutions to those problems. But it's all done in a very structured way so that we make real progress on those solutions that people can see, first test before we actually implement, but then can implement to see real results in our outcomes.
What we wanted to do when we created the health system brand of LEAP was to really own the tools and the philosophy for ourselves. So LEAP is an acronym. It stands for 4 verbs that we as a group felt really captured the essence of the philosophy for us. And so L is learn, E is engage, A is aspire, and P is perfect.
One of the great things about LEAP is how applicable it is to really any kind of process. So while we've had great early successes in the medical center, we've had extraordinary successes in other divisions as well. Perhaps one of the ones that is most meaningful to me is the reduction in how long it takes us to get someone into the home of an elderly or disabled person who really needs that help to stay out of the hospital or out of a skilled nursing home. Until we started LEAP, the waiting time was over 120 days. We're now down below 30 days, and our aim is to get even faster. It's very much a plan, do, check, and then act. So using measures is really the way we make sure that we're actually making progress.
And this goes to patient safety, which is very important to me. It's very important to all the providers here. When patients were seen and left our clinic, we would give them a set of instructions. And it wasn't happening all the time because people were busy. Simple things like a printer being too far away was a big barrier for people. But we all the while knew it was really important for patient safety, so they knew what their medication list was. And so using LEAP principles, a team of my colleagues and front desk staff came together, and nursing staff, and they devised a step-by-step process of how to do this. and they timed us doing it, and they really made it as efficient as possible, even putting a printer near the nurses so they could grab the paper. Small changes like that. And we track to see what percentage of patients are going home with that piece of paper, which is really helpful. For most providers, it's at or above 90% now, and I think that's a great thing. It makes things better for patients.
It's great in this work to be able to really step into the shoes of the patient. So for example, we brought patients in who had been in our psychiatric emergency room during these periods of unbelievable crisis and talked to us about what their experience was like during that time.
My name's Nancy Wilson, and about 6 years ago, I came to this hospital for treatment in the psychiatric ward. And they kept me here on the hospital for the 72-hour hold, and they extended it. So I ended up staying for almost 2 months. The environment wasn't welcoming. It didn't feel safe like it was supposed to be. And the fact that the choices were taken away from you when you're in a locked facility, right? It's not like you could just walk out the door. But I think they tended to forget that we still have choices, as simple as they may be, like what kind of Jell-O do you want to eat? Do you want to take a shower now or later? It was more of a, this is the way we do it, we're going to do this with everybody, even forgetting that you're an individual. Then they asked me to participate, and I felt excited. I felt like they're making changes, and the changes that were necessary, and I felt they asked me because who better to ask than somebody who went through the system.
It was incredibly meaningful because they were able to tell us that their lives had been saved by the work that we had done, but that sometimes along the way, we really hadn't treated them like human beings, and that we had looked right through them, that we hadn't looked at them in the eye, that we hadn't told them that we cared about what was going on with them. And those moments were really meaningful.
I would describe LEAP as a transformation tool.